Welcome, everyone. My name again is Ian Sanders with Oasis Financial Services. Today, we're just going to talk real quick about deductibles, co-insurance, and how to read what you're looking at when you're on the marketplace. Now, normally you do want to work with a broker or with an agent, but if you're not for some reason, video should help you be able to read through your benefits page and pick a plan that works out well for you and your family. If you do like what you see here, it's helpful. Go ahead and like, subscribe, and comment. Helps us get in front of more people. And the more that we can get this information out to people, the better. All right, so what we're going to do is just take a quick look at this. So this is just a standard benefits page. You can see it's through Blue Cross Blue Shield. Not using them for any particular reason. It's just for illustration purposes. The CSR, you'll want to go with the silver plan with the CSR if when you go through and put your information in, you get this little badge. I'll just go back real quick just so that you can see it. But the cost sharing reduction is here where it says CSR. And so that normally means you'll want to go with the silver plan. The reason for that is because it has the lower doctor's visits and a lower doctor visit copays and specialist copays. All right, so looking at the plan details. So what you're going to see here is your deductible. Now, what your deductible is what you're going to pay if you had to go to the hospital normally or have lab work done and things like that. So your insurance isn't going to pay anything until you reach the first $5,700 on this particular plan, and then 11,400 for the family. So what that means is, let's say it's me, my wife, and four kids. Well, each of us would have to pay 5,700 before the plan would kick in for us. But if as a family we hit 11,400, then everyone would then have the copays. The copays on this particular plan, if you scroll down, are going to be 40% after deductible is met. So you can see that here. Now, the next thing that we're going to look at is the out-of-pocket maximum, which is 7,200, which is 14,400 for the family. And what that means is that after you've met this, then everything's going to be covered 100%. So that's your out-of-pocket maximum. Now, what that means in this case when it comes to your doctor's visits is nothing. So you can see here, before the deductible, it's $40 for primary care, $80 for a specialist, and then no charge for your preventative care visits. After the deductible, it's going to be the same thing. Now, where you'll see where this can change is with your when it comes to prescriptions is going, or excuse me, when it comes to copays is going to be your prescription drugs. So you have $20 here for your generics, $40 for your brand names. It's going to be the same before or after your deductible. But for your non-preferred brand names and your specialty medications like cancer drugs and things that are more expensive, you pay the full price and it goes towards your deductible. And then after that, you have an $80 copay and a $350 copay. Everything else is going to be 40% after you hit your deductible. And that's more or less how the plan works. So again, this was just a quick look at the Blue Cross Blue Shield plan. I'm not saying that this plan is better or worse than any other plan. There was no reason for picking it. It was just so that we could show you what the deductibles were and what that actually looks like on the Health Sherpa website or on the marketplace website so that you can see this. My suggestion, though, is always, even if you know this, is still going to be to work with a broker or an agent. The reason for it is the application can be a little tricky sometimes. And I've seen this many times where I work with a new person who went on to the exchange.healthcare.gov website, picked a plan, went through all of that, but they end up paying much more per month because they didn't fill out the information correctly to get the subsidy correct. Or they thought that they weren't able to sign up for their plans because they were outside of the open enrollment period, but turns out they recently lost coverage or came off of Medicaid and were then able to get into a plan. So always check with a professional that can help you out. If you do have any questions or want me to look into anything, or you just want to have a discussion about healthcare and how it can affect you and your family, go ahead and leave a comment or a message, or you can click on the link below and schedule a time. It is a free consultation, and I look forward to hearing from you. Have a great rest of your day and have a great week.